Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm starting a new series on the COVID pandemic. This is the number one health issue now throughout the world. In this country, there is now a resurgence. Just about every state in the union has now seen a recurrence, an increase in COVID infection cases. As of today, we have 10,402,273 cases in the United States of America of people that have become infected. Of that number, 241,808 folks have already died. And worldwide, we have 52 million folks have already contacted the virus, and 1,290,000 folks have already died worldwide from the disease. That's a very, very unbelievable. And in this country now, the hospitalization rate has increased to about 61,000 the last few days. It is incredible. Unfortunately, the largest percentage of those people who have been hospitalized happen to be blacks and Latinos and etc., minorities. It is a disaster. Now, the public now is now being made aware of the incredible racial disparities that exist in the field of medicine in this country, and it is unbelievable. I've spent years writing books and articles about the subject. Now it is in plain view, okay? It is very sad, but that's the reality that we have to deal with. When I left off last week, I was in the middle of talking about the clotting problems that have been discovered in folks who are very sick with COVID. Well, I'll get back to it in a second. Let's go back to the predisposing factors, okay? Being a minority, men and women. In my view, that's one key predisposing factors. Obesity, asthma, COPD, heart disease, anemias, end-stage renal disease, strokes, on and on and on and on. It is a disaster. Okay, now last week I mentioned the fact that now people who are infected, they find many of these people are having serious clotting problems that are affecting the heart and other organs in the body. And what I talked about last week is the fact that there are 9 or 10 major substances that people have in their system. They're called thrombophilias. Either you were born with them or you acquired them during lifetime. I'm going to go over them with you again so that you understand, and then I'll explain to you how bad these things can be. You have anti-cardiolipin antibody. That's a thrombophilia. That can only occur in women if they were pregnant. Even though the pregnancy was not carried to term, they were pregnant once. That's enough for them to have acquired anti-cardiolipin antibody. It is the mother that is developed an antibody against the fetus. The fetus is the antigen. Very, very bad condition when it does occur. And then we have homocysteine. There are folks actually born with homocysteine. That's a very bad condition. But a lot of folks can also acquire abnormal homocysteine during lifetime. And then one of the most common one that very few people have heard of is lipoprotein A. Now, lipoprotein A is a substance that is produced in the liver, in the human liver, that it is transmittable. It can come from parents to offspring. This is deadly, super deadly. 20% of the U.S. population have elevated lipoprotein A. Okay? And then you don't hear much about it because these are new things in the new medicine, in the new science that are being discovered the last 10 years or so. And unless one is involved in academic teaching, in academic writing, in academic practice of medicine, you wouldn't hear about these things. 20%. Let me tell you how bad it is. It's not only bad, it also works in concert. It works in concert with LDL cholesterol to increase the risk of coronary occlusive disease. Let me repeat that. Elevated lipoprotein A works in concert with LDL cholesterol to increase the risk of coronary occlusive disease. Okay? Now, pay close attention. All human beings have two substances in the blood that allows the blood to remain liquid. That is plasminogen and, of course, heparin. Plasminogen and heparin, those are the two things that we have in our bloodstream that keeps our blood from being too thick and clot on us. Now, what the lipoprotein A is capable of doing, in addition to a whole bunch of other stuff that I'll tell you about, when one is under stress of different types, it could be personal psychological stress, or it could be stress related to the disease, etc. The lipoprotein A is able, believe it or not, is able to push aside, literally push aside heparin and also push aside plasminogen, rendering them ineffective, allowing the blood to become too thick, and then disaster develop. That's acutely. That can happen acutely, leading to clotting. But even when that is not happening acutely, not only that, elevated lipoprotein A is capable of working in concert with LDL cholesterol to increase the risk of coronary occlusive disease, but the lipoprotein A also by itself, without you knowing anything about it, you minding your own business, doing your daily work, while you're doing that, the lipoprotein is capable of damaging, causing major damage in the high flow system, namely the arterial system. That's what we call the high flow system, which means that you minding your own business, and all of a sudden, out of the blue, you have a stroke. And when we evaluate you for the stroke, we find that you didn't have high blood pressure, you didn't have diabetes, turned out you had elevated lipoprotein A that was damaging brain cell all along without you knowing anything about it. And all of a sudden, you're minding your own business, you didn't have a stroke, and you're stumbling around, you're having difficulty walking, having difficulty talking. When they evaluated you, you found out you have severe, let me repeat that, severe microvascular disease of the brain, secondary to elevated lipoprotein A. How can you not know this stuff? This is so crucial, so important, and it is in my practice, roughly 60 to 70% of my black folks in my practice have elevated lipoprotein A. How do I know that? Because once I agree to take care of them, I screen them for abnormalities that I know that I'm much more familiar with people of color. That's right. I don't screen them to discriminate against them. I am a Negro myself, but I know what diseases that are much more commonly found in these individuals, so that every single patient in my practice, no matter ethnicity, they're all been screened by me the minute. See this form right here in my hand. I created the sheets. This is a laboratory request form. There are more than 200 tests on this sheet. I did it myself over the 43 years of practice. No other office has that. Yes, the laboratory request form have some stuff in it. They don't come close. They don't even have 10% of what's here. And there is no diseases known to mankind worldwide that I cannot diagnose using this form. Once I finish taking the history from the patient, I check off this, I check off that, I check off this, I check off that, bingo, the diagnosis is established. How about that? And then on top of that, when I'm seeing them for the first time, if I agree to do, and I don't take new patients, please don't call me. When I agree to see, I have most of, the average patient in my practice has been with me about 35, 40 years, okay? This is how long they've been with me. Every single one of these individuals have been screened for multiple diseases, multitude of diseases that are only found mostly in that population. And if you don't know that, how? You tell me how you're going to practice high quality medicine for these folks. You're not going to. I don't care how smart you are. And believe me, there's a tremendous amount of smart doctors out there, brilliant doctors. But that's not the way they were trained. And then you have to fight on top of that with the insurance company to pay for this stuff. But once you know what you're talking about, you pick up the phone and say, give me the medical director. Okay? I had such a case last year at a hospital that shall remain unnamed on Davis Avenue. They won't pay for the hospitalization. They won't pay for it. Okay, fine. I said, give me the medical director. I take days of fighting. The man finally picked up the phone. He said, Dr. Alcena, I understand what you're talking about. And he repeated, and I quote, there is not a single physician, Dr. Alcena, in this country that I respect more than I respect you. So therefore, the case is approved. No further argument, period. That's Santa Clara Hospital. When they head on the website and put that case as an example on how other physicians should fight for their own patient. This is a true story, okay? Because I know what I'm talking about. And people who are in the field of academic medicine know that I know what I'm talking about, okay? So therefore, they dare not bother with me when I speak, okay? Now, so this is how important lipoprotein A is. You have lipoprotein A, you look very sick. You're lying in the bed. That is like you are sick with COVID. Take the COVID as an example. This is a section about COVID. How can you have COVID and have all these things in your system and don't get clotted because of them? Yes, you will clot. And let me tell you another one after the homocysteine A. How about lupus anticoagulant? And you don't have to have lupus to have lupus anticoagulant. That's a misunderstanding. Yes, if you have systemic lupus erythematosus, you're more likely to develop lupus, but you don't have to have lupus to have lupus anticoagulant. How about that? And if you have lupus anticoagulant, you are going to clot. And you're also going to have microvascularitis of the brain if you're not giving medication to prevent them from occurring. That's a terrible condition. You have to understand something. 95% of black folks, take that as an example, who develop dementia, don't have dementia because of Alzheimer's. 95%. Most of them have dementia because of these different things that I'm telling you about: hypertension, diabetes, high cholesterol, thrombophilias, etc. That's exactly correct. They may behave similarly when you're talking to them, and they were there doing their daily thing, but it is not what you call it, Alzheimer's. Okay, 5.5 million people in this country have Alzheimer's. It's a terrible disease, yes, but the bulk of people who have dementia in this country don't have Alzheimer's. They have dementia secondary to some of this stuff that I'm telling you about. Let's talk about another one, protein C level. If your protein C level is low, your blood is going to be too thick and you're going to clot. You could develop protein C level for a very different reason. If you have kidney disease, for instance, and you are pouring out protein when you have bad kidney disease, you lose a lot of protein, a lot of albumin in your urine all the time. You're losing protein C that way. If you have kidney disease and you have low protein S, yes, that may be why your protein S is low, because you're pouring out protein. It's also a protein, you're losing it that way. Okay? Now, here's another one. How about antithrombin 3? Now, that's crucial. Yes, they're all crucial, but listen to this. Just relax. Listen to this. Antithrombin 3 is needed in order for heparin to work. How about that? Antithrombin 3 by itself, when it's too low, it's a thrombophilia. By itself, it's a problem. In addition to that, your heparin that you have in your system will not work if your antithrombin 3 level is low, because without the antithrombin 3, heparin is useless. How about that? How about that, okay? Okay, so that's one. And then the individual who most likely develop antithrombin 2 deficiency are women, in particular when they're pregnant. Okay. Now you tell me how many people who are doing a great job delivering babies, etc., know about that. You tell me how many. And these are the people they're providing care for. And I'm here to tell you, in this country, the vast majority of women who die while giving birth is because they have a whole lot of stuff. It's usually from clotting, it's usually from bleeding. Okay, it's clotting, bleeding are the two most common causes of death in pregnancy, during pregnancy, throughout the world. And in this country, you have more women dying during pregnancy than any other developed country in the world. And the vast majority of these women happen to be black women. How about that? Because they have all these predisposing conditions, nobody knew anything about them, and then one of the most important things, listen, just relax, okay? One of the important things you have to understand, a woman cannot carry a baby without estrogen. How about that? And the number one hormone, are you ready for this? The number one hormone that's going to cause the woman to clot is the estrogen. That's right. And yet you cannot carry, there's no way possible for a woman to carry an infant through pregnancy without an elevated level of estrogen. And I'm here to tell you, the last hormone you want to come near when you have any one of these things happen to be estrogen. How can the woman not clot? She's a woman. She's giving birth. The baby will not survive, will not grow into the womb without several other hormones, including estrogen. And I'm telling you, the number one hormone that is contraindicated when your antithrombin 3 is low is estrogen. Okay? And it's not only estrogen, you have no idea how important a hormone it is, but I'm telling you, you have got to know this stuff so that you take the necessary precaution to prevent the unnecessary death that is likely to occur, because that's the science. That's the science. That's the physiology. That's the way God created the body. You have got to learn these things. You have got to know these things if you are going to take on the responsibility of providing care for a patient. I have been a patient several times. Several times I've been a patient, and I almost died because I was provided lousy medical care. I had to fire the doctors when I realized that I was dying. Fire the doctors, say, I'm sorry, don't touch me anymore, get myself the heck out of the hospital, went home, and came back, readmitted myself under the name of a younger associate that I had working in my office. I said, Glenn, listen to me. I'm going to readmit myself under your name. And every morning you come into the room, I'll sit down and tell you what to do, what to write, what to do for me. That's what saved my life. How about that? Okay? I'm not criticizing. I'm telling you a true story that happened. Okay? True story that happened. 3 separate times I had cancer. 3 separate times my cancer was misdiagnosed. 3 separate times I had to take this pad in my pocket right here, write a prescription to do the proper thing to diagnose my own cancer. How about that? Okay? So what I'm talking about, I'm a patient advocate. Let me tell you, I experience this stuff. That's why I fight every day for my patient. I fight every day. I write this book not to make money, but to help. I do this show not to make money, but to help, because this country has been so great to me. This is payback to this greatest country that has helped me to sit here and talk to you. That is all. I don't care about the money. What am I going to do with the money? Take it with me? Come on, give me a break. So now here's another one that you need to know about. Factor V Leiden. Factor V Leiden is seen mostly in people of immediate European ancestry. Immediate European ancestry. You have these people, they're having this clotting. You got to know, you have to check them for factor V Leiden. That may be the reason why they clot. They're going to clot. Okay? All right. Here's another one. How about the prothrombin G2021 mutation. Again, that's European type gene for people that have mostly European, immediate European ancestry. Even though I told you, I had a Latina lady years ago when I was practice like full of patients doing this, doing that, writing articles, trying to get promoted, blah, blah, blah. I was hot. I diagnosed her. She couldn't believe it. Well, it turns out that when I take the back of her history, her immediate grandfather or immediate grandmother came from Spain. Spain is part of Europe, and this is a European gene. I saved her life. How about that? Okay. So now, getting back to COVID, it's almost 100% of the time. Almost 100% of people clot because they become over hypercoagulable. Hypercoagulability is due almost 100% of the time due to underlying thrombophilia. Yeah. Underlying thrombophilia that people have, they know nothing about it. And now they get very sick, they become immobilized, and then bango, they clot, either in the low flow system, which is the venous system, or the high flow system, meaning the arterial system. They're going to clot. And there's another big one. And by the way, you need to know, I don't know why I'm telling you all this stuff, but I will anyway. Why am I going to take it with me? Let me tell you something. If you have a patient that you're taking care of, and the patient develops a clot, a thrombosis in the leg, a clot in the lungs, or whatever, it is your responsibility to do a hypercoagulable workup to see if the patient got any one of these things. If you come out empty, the patient doesn't have any of this stuff, and your patient clot, guess what your other responsibility is? You have to look for the underlying cancer that causes the patient to clot, a condition called Trousseau's syndrome. How about that? Let me repeat that. If you have a patient that clot, either in the low flow system or the high flow system, and you do yourself a fancy hypercoagulable evaluation, those of them are on the sheet, about 9, 10 different tests that you have to do, and they come back empty. You cannot detect any one of these things that may have caused the patient to become hypercoagulable. You have just diagnosed occult malignancy. That's right. Therefore, you have a responsibility. You can't just, yes, you see the clot, you diagnose the clot, you're going to treat the clot, but you have to find out why the patient clotted. What was the underlying reason? If you come out completely empty, then you have just diagnosed an occult malignancy, which means it is your job to find out which malignancy it is. Okay, and that's called Trousseau syndrome. Dr. Trousseau was a French surgeon who lived in the 1800s. He diagnosed the first case of Trousseau syndrome in a patient with pancreatic cancer. Unfortunately, this brilliant surgeon himself subsequently died of the same syndrome that he himself diagnosed and exposed to the world of cancer of the stomach. How about that? Dr. Trousseau did not die of cancer of the pancreas, he died of cancer of the stomach. And therefore then, if you have cancer of your big toenail, big toe, which can happen, you better believe it, you could clot. All cancer can cause you to develop Trousseau syndrome, no matter the name of the cancer, no matter the type of the cancer. You must understand that. So, because the way you might treat the patient for the cancer, which you will, and you still wind up losing the patient because the patient had Trousseau syndrome you didn't know, because you didn't evaluate for it. How about that? Okay? So, now let's go about now then telling you a little bit how we go about evaluating. Listen, I have plenty of time. This is my show, and I'm just starting this series on COVID. I have plenty of time to go over it because we're dealing with this terrible pandemic. We're nowhere near. Yes, we have a vaccine. That's it's going to be very good by Pfizer. Congratulations for Pfizer. We're all looking forward to it. Yes, we have an antibody by Lilly. They say that can cure this thing. Well, we look forward to that. All of us are looking forward to it. And if the time comes, it is safe, believe me, I'll take it, as long as it is proven to be safe. But I want you to understand that this stuff is really complicated. There's nothing simple about it. So, therefore, then, when somebody shows up, they, you're evaluating them, you find that they have a swollen leg, then you examine them, you take the history from them, what medication they're taking, have they taken any hormone or whatever. Men is taking testosterone, women they're taking estrogen or whatever. Then you send them to the X-ray department, get yourself your ultrasound, you document the clot. Then you have got to treat the clot. But once you document the clot, you got to be careful. You must also evaluate the lung by doing a CT angio to make sure that the clot has already dislodged into the lung. The patient does not have to have symptoms. I have 2 cases a few years ago, weeks apart. Patient had leg clot. They wind up with lungs, with clots, and then with no symptom of lung or cardiac problem. So now that you've done that, now you're going to do a series of blood tests, obviously. You're going to do the CBC, the metabolic profile, the PT-PTT, because you're going to treat the patient. You make sure they have the PTT is normal, the INI is normal, the PT is normal. Then you must do a D-dimer. That's the bottom line. The D-dimer is a key test that's going to tell you, other than the X-ray, even if you have proven it, you already know it, you must do the D-dimer, because you're going to use the D-dimer to monitor what's going on with the clot. Okay, as long as the clot is there, the more the clot, the higher the D-dimer. It's very important. You can't just say, well, this is the clot. You must do the D-dimer. Okay, and then if you are in any setting, you suspect that somebody may have some kind of a clot either in the brain or in the heart, you're working in the emergency room, you do a D-dimer. Yeah, because you cannot have a clot anywhere in the human body without having an elevated D-dimer. How about that? You cannot have a clot any place in the human body, from the earlobe down to the toenail, without having elevated D-dimer. So the D-dimer help you to make the diagnosis. The D-dimer also help you to manage the patient's progress as you're treating the patient. See? See how much you're learning this stuff? So, and you must know how to treat the clot. You must know, because we have 2 different types of clot. We got the white clot and the red clot. The red clot has no platelet, very few platelet. It's white cell and debris. The white clot is packed with white cell and platelet. That's why they call it white thrombus and red thrombus. If you don't know this stuff, my goodness, how are you going to treat the patient? The treatment are different, completely separate thing, 2 different worlds. So you have to know this stuff. Listen, gloves, sanitizer, soap, put your mask on, as well as put the glove on when you go to the supermarket to protect yourself. I'll see you soon. Dr. Alcena saying so long and bye-bye.